Hello and good evening. This is Alalade, one of your admins at Ask the Gynecologist. And tonight is one of our maiden shows about how to look after yourself during pregnancy. And tonight I'll be talking about antenatal care. Antenatal care. So listen attentively and let's talk a little bit about this essential, sensitive, most important topic. Like I always do, I won't take more than 10 minutes of your time. Ensure you listen, follow me, and let us share the important things you should do while you're trying to get pregnant. This topic today is not about infertility. Okay, this topic I'll quickly kind of fast forward. You've done all your best to get pregnant. Now you're pregnant. What are the things you should do, and what are the minimum things you should expect during your antenatal care all through pregnancy? That is what I'm talking about tonight. Antenatal care. The things you should expect, you should do during the time you get pregnant. Okay, so first of all, before getting pregnant, obviously, if you have any medical conditions like kidney problems, your kidney should be optimized, your blood pressure should be optimized, checked, and ensure that your blood pressure is stable. And we move you to a safer medication for your blood pressure control during pregnancy. If you're epileptic, you should be seizure free for at least a year before trying to get pregnant. If you got thyroid problems, we ensure that your thyroid hormone are well controlled before getting pregnant. That's important. That is totally important. And essentially, you should be taking your folic acid. Folic acid, 400 microgram or 5 milligram, depending on your clinical circumstances, as advised by your doctor before getting pregnant, 3 months before getting pregnant. So while you're on that folic acid, you try to get pregnant. If you can't do 3 months, minimum 1 month before getting pregnant. If you have high BMI, you got diabetes, you got blood pressure problems, you had a child before that had neural tube defect, you should be on 5 milligram of folic acid. Otherwise, you can be on 400 microgram if you've never had this kind of problem before. So, or even if you're epileptic, you should be on 5 milligram. Okay, so you've taken your folic acid 1 month before getting pregnant, or 3 months before getting pregnant. That's fine. So once you get pregnant, you should get at least one scan at 12 weeks. And the essence of that scan at 12 weeks is to ensure that we can date your pregnancy. The reason is that, see, once we get your earliest date of confinement or estimated date of confinement, I'll say it again, EDD, estimated date of confinement, EDD, we get that date much reliably by using your 12-week scans. 12-week scan. So we do your 12-week scan, we measure the crown rump length to get your estimated due date. That's important at your 12-week scan. So if you're pregnant, do not miss that 12-week scan. It's important. That's why you need to keep an eye on your period, on your last period, So if today is the first day you see your last period before you got pregnant, mark today. So all the time, just keep a diary as a woman. You can even have all these apps on your phone. So as soon as you see your period, you mark it on your app. So just in case you get pregnant, you can have an idea of the first day of your period because it's on your app, it's on your phone. As a woman, if you have a smartphone, you should have that app, a lot of free apps on your phone, which you can mark your menstrual calendar. If you don't have the smartphone, get an exercise book, get a small jotter, put it in your purse and mark it. It's important as a woman. You cannot do without it in this day and age. Okay, so get it. So 12-week scan is important, paramount, important. I'm talking of the most important scans. But if you have other problems, your amount of scans will increase. So 12-week scan, essential. Then your 20-week scan. Once you get to 20 weeks, the purpose is to check whether there's any abnormality with your baby. So we do a 20-week scan. In that 20-week scan, we're checking the baby's brain, the baby's heart, the lungs, the kidney, the liver, the stomach, the long bones, to ensure that they are all well formed and there's no abnormality in them. And if we suspect any, we now refer you to a full and more detailed scan by a fetal medicine specialist. So 12-week scan, 20-week scan. Then after that 20-week scan, if your baby is fine, baby is moving, baby is growing, no problem, the first scan you should have will be around 26 or 28 weeks to monitor baby's growth. So if your 26 or 28 week scan is okay, then we move again to do another scan around 4 or 5 weeks after. So that will take you to around 32 or 33 weeks. So around 33 weeks, you do a growth scan to ensure that baby is growing well. Okay, and after that 33-week scan or around that time, that one is okay. We'll do another one around 38 weeks. And that should be enough. If your baby is growing well, that's enough. So if you look at it, you have your first scan at 12, 20, 26, 33, 38. 5 scans minimum. You should have that all through your pregnancy. If you listen to me again, your first scan at 12 weeks to know your due date. 20 weeks scan, anomaly scan, to know whether there's any abnormality with your baby. And the next scan is what? 26-week scan, which is called growth scan. So from your 26-week scan onward, it's called growth scan to ensure that baby is growing well. Now, if you baby is growing well, that's all you need. Sometimes some baby will not be growing well. We call them IUGR, intrauterine growth retardation. For such babies, we need to monitor them much closely, much more frequently. In such cases, we'll be doing more frequent scan, maybe every 2 weeks. Or even if you have diabetes, or if you had a history of a small baby before, we'll be doing scan every 2 weeks from 26 weeks onwards, or every 3 weeks from 26 weeks onwards. If you're carrying twins, triplets, quadruplets, if you had IVF before, we'll be doing regular scan every 2 weeks or every 3 weeks, depending on the baby's circumstances. We'll be checking the blood flow in the cord to baby. So on your 12-week scan, we do CRL to know your due date. 20-week scan, we check all the baby structures, that they are well formed. If that is okay, we move to your 26-week scan. On your 26-week scan, what do? We're checking that the blood flow in the cord to baby is fine. That is your first growth scan, 26 weeks, that the blood flow in the cord to baby is okay, is doing well. We check that. Important, not bargainable. We check that baby is growing well by doing so many measurements on baby's head, baby's tummy, legs, and we check the water around the baby, that they are all fine and they are all of sufficient and good quantity. We check all this during your 26 weeks or your first growth scan, and all your subsequent growth scan. We do all this all the time. It's important, it's paramount. Okay, so we do all this all the time. Essential. Now, if you have twins, if you had IVF, previous history of small babies, we do scans more frequently, and we check the same things in these your subsequent scans. Important. Now, if you've had a previous ectopic pregnancy, maybe one tube has been damaged and is taken away from previous surgery from ectopic pregnancy, once you get pregnant around 4 or 5 or 6 weeks, we want to ensure that you're not carrying ectopic. We want to ensure that the baby is in the right place in the womb. So if you had a previous ectopic pregnancy, once you miss your period, once you have a test of pregnancy that is positive, we want to see you in the scan clinic, in the scan office, to do a scan. Why? To check that your baby is in the right place in your womb, check that the baby is growing well and it's not another ectopic or a failed pregnancy. If you've had recurrent miscarriages before, if you had IVF treatment, we want to know that the pregnancy is in the right place. The pregnancy is not ectopic pregnancy. The pregnancy is not failing. So we do a scan much earlier than the 12-week scan. Can you see the difference? If you had a previous recurrent miscarriages around 12, 14, 15, 16 weeks, 16 weeks, 20 weeks, and you have history of knowing that your cervix is so weak, we want to do a scan, or much frequent scan from 12 weeks to 16 weeks, 20 weeks, so that we can know whether you need a sacrilege in your cervix. So if you have some peculiar problems, you may need more frequent scan during your antenatal care. Every antenatal clinic you go, we must always check your blood pressure, check your urine sample. Okay, that there's no protein, there's no glucose there. If there's protein in your urine sample, it could be an infection. It could be that you got blood pressure problems in pregnancy. This can come up if you've had a history of blood pressure problems before. If you've had a history of blood pressure problems before, if you have history of small babies before, if you had a family history of blood pressure, if you have history of diabetes, or if you had history of other babies being small before, you may have, or you may be prone to having blood pressure problems in your pregnancy. So we want to ensure we check your urine test all the time you come for antenatal care. Important, not bargainable. Okay, if you're not vaccinated, we want to give you vaccines during pregnancy, especially the ones that can damage baby. Some vaccines can damage baby. Those ones, they're usually the viral vaccines. We don't give them, like the polio and the rubella, the mumps. We give them after you've had a baby or before you get pregnant. So if you got pregnant, forget those vaccines. Go for the bacterial vaccines, the DPT, diphtheria, tetanus, toxin, and pertussis. They are bacterial vaccines. They are safe in pregnancy. If you're not sure, ask your doctor. If you're not sure, come and ask me, ask gynecologist. I will explain better to you. You can join our antenatal service in ATG. Ask the gynecologist. It's one of the biggest Facebook groups, about 1.5 million members. We talked about pregnancy issues, maternal issues, and things you should know about your health, about as a woman. even if you're a man, to know about the health of your daughter. So be there, join us there, and let us share ideas. So this is just a nutshell of the things that should be done and must be done during your antenatal care. Ensure you do this minimum. You may need other sorts of more closer follow-up if you have any peculiar problems at all during your pregnancy. Thank you once more for watching me tonight. I really appreciate you. God bless you. Hope to see you soon. Alalade Babajide, one of your admins at Ask the Gynecologist. Bye-bye, and have a wonderful night. Have a wonderful day. God bless you. Bye-bye.